Great. Thank you so much, Dan, and welcome to everybody. Just to mention, HARC is supported through a cooperative agreement with HRSA. The information, content, and conclusions are those of the authors. Before we get started, we'd like to take a minute to learn more about our audience today. HARC includes members across many different groups with an interest in home visiting, and I'm going to put a link here in the chat, and from that link, please choose which role best describes you. It looks like the majority are researchers and evaluators, so welcome. We do have some representatives from other groups, such as home visiting model representatives, tribal, state, and territory home visiting leaders, and program staff. So we welcome you all. All right, so let's get started. First, a brief overview of the precision paradigm. A key objective of HARC is to promote active engagement in conceptualizing, designing, and implementing studies among those interested in building home visiting evidence. This includes researchers and evaluators, home visiting models, tribal and state leaders, policymakers, local program staff, and families. HARC is building the precision paradigm to support collaborative research by developing a shared language. While we will refer to research most often throughout today's presentation, it's very important to mention that the precision paradigm is also highly relevant to home visiting evaluation and quality improvement projects that aim to guide program improvement and policy. To put it most simply, the precision paradigm is a framework for organizing and defining information across these 7 components and how they relate to one another. Many, but not all, interventions within home visiting aim to support specific behaviors, such as the use of developmental parenting practices, healthy nutritional practices, or seeking help for a child's developmental delay or maternal depression. This framework is best suited to support research on home visiting outcomes that are tied to some behavioral component. The precision paradigm can help collaborators conceptualize and see how aspects of interventions within home visiting are expected to improve a specific outcome within a specific context. The paradigm allows collaborators to chart out or specify how change is intended to occur using the row of components along the top. Starting from the right and working to the left, collaborators can identify and specify an intended home visiting outcome, the selected behaviors needed to achieve that outcome, the mechanisms through which an intervention is thought to affect these behaviors, and key aspects of the intervention itself, which includes content, specific intervention techniques, details about how the intervention is delivered, and tailoring. Then, along the bottom, collaborators can consider and specify the factors that might influence the path from intervention to outcomes in important ways. So, for example, how aspects of usage, which includes home visiting reach and engagement, might influence an intervention's effectiveness, and how context can influence both usage and intervention effectiveness. The paradigm shares similar characteristics with other theory of change frameworks. We can view this top row as the intent of how interventions are planned to operate to achieve outcomes, but the paradigm goes further by encouraging researchers and their collaborators to build in the real-world considerations through context and usage to understand what likely influences that intended path to outcomes. So how can the precision paradigm be used? The paradigm provides a useful tool for home visiting research, evaluation, and intervention design that can help advance precision research by sparking conversation and addressing unanswered questions about how home visiting works best for families and in what contexts. Encouraging greater granularity and consistency in how we describe and report home visiting interventions and the process through which we expect intervention effects to occur. Guiding the development of research studies in which the design, methods, and measures are all well aligned with the components of the paradigm. Considering how a broad array of contextual factors might enhance or diminish home visiting usage and effectiveness in achieving those outcomes. And lastly, home visiting cannot address all needs that families have, and as such will always offer only a partial solution to what a family may need to care for their children. The paradigm can help the field to better understand home visiting's unique contribution in larger systems of care and in buffering the effects of family adversity within the broader social, economic, and environmental context. What do we mean when we say we are building the precision paradigm? The paradigm represents an effort to build on and extend existing knowledge to encourage the field to be more precise in how we define, develop, and test interventions within home visiting. The individual components of the paradigm are not new. However, descriptions of home visiting interventions and research often lack specificity and don't use a standardized language around common concepts. This can impede our understanding and the ability to build on each other's work. So in building the paradigm, HARC's goal is to develop resources and tools that specify each box of the paradigm as completely as possible. These resources will provide menus of options or taxonomies for classifying key aspects of home visiting. These options are being described using clear and commonly understood terms and organized in meaningful groupings. These taxonomies or menus make it easier for collaborators to communicate with one another when developing, describing, and testing interventions within home visiting. Additionally, our hope is that these resources will also be useful for model developers and local program leadership in characterizing interventions in their program manuals, training materials, and in their own evaluation and CQI initiatives. HARC is developing these taxonomies using existing literature with input from individuals and groups with experience in home visiting and closely related fields. It is important to note that the paradigm's components are not prescriptive. The paradigm does not dictate what should be. Rather, it provides a standard language and organizational scheme for defining components being considered in research evaluation and quality improvement. All of this is an effort to advance the field's understanding of what works best for whom, both in services to families, but also in implementation system supports for home visiting staff. So today, Heather, Becky, and I will share HARC's progress in developing resources and taxonomies for three components of the precision paradigm: mechanisms of action, context, and usage. Then we'll wrap up our presentation today with an attempt to put it all together by using an example from home visiting to show how the paradigm can be used to organize and generate relevant research questions. Before leaving this slide, though, I do want to note that HARC is not ignoring the intervention component. This will be the focus of our work in the coming year. Let's focus first on mechanisms of action. What are mechanisms of action, or MoAs, as I'll refer to them? Interventions within home visiting can be broken down into many different specific techniques used by home visitors in working with families. Techniques are things like providing information, role-playing, giving a referral, or providing feedback. These techniques then are often used to promote selected behaviors, such as a parent using positive reinforcement to shape their toddler's behavior, or a parent accepting and following through on a referral. MoAs are the modifiable constructs that link these specific techniques to selected behaviors. They help us to understand the pathway from intervention to outcomes, and specifically what a technique targets in order to result in the selected behavior. MoAs come from theories, the social learning theory or the stages of change theory, and they explain the how and why specific intervention techniques are expected to lead to a program's intended outcomes. Interventions within home visiting may be designed to influence selected behaviors through MoAs, such as building new knowledge and skills, changing one's beliefs about capabilities or their self-efficacy, and providing resources that address barriers. It's important to consider MoAs in studying home visiting interventions to understand how and why a program succeeds or fails to achieve intended outcomes. For an intervention to be successful, it must target the correct mechanism or precursor to behavior change. Understanding how well a program's interventions target relevant MoAs is key to understanding how to broaden and strengthen their impact on outcomes. Without this understanding, it is hard to know how to refine the program's interventions. So let's illustrate this with a couple of examples. So in this first one, if we start from the far right, a home visiting program aims to prevent child injury. One way to do this is to improve home safety. There are many ways a home visitor can work with a family to do this, but one technique a home visitor may use is to provide the family with safety measures like stair gates and outlet covers. So what is the MoA? How does providing stair gates and outlet covers influence home safety? So here on your screen are three different MoAs and their definitions. And I'm going to put the link in the chat again for another poll. And from that, which MoA do you think is the most likely link between this technique and this selected behavior? I'll give about 15 seconds or so. Let's see what we think. A resounding 100% for B, environment and resources. Yes, it is environment and resources. So providing resources such as baby gates assist families in altering the home to make sure the environment is safe for a mobile toddler. Let's try one more. So in this example, starting again from the far right, a home visiting program aims to promote secure infant attachment. One parenting behavior related to infant attachment is their responsiveness to their infant's cues of distress, such as crying or fussiness. Again, there are many ways a home visitor may support a parent in this, but one technique may be for the home visitor to demonstrate positive responses to a crying infant. So again, what is the MOA here? Using that same link in the chat, which MOA from this taxonomy is most likely linked between the technique and the selected behavior? See what folks think. It's not what I wanted to do. So the majority of folks answered C, social learning and imitation. One more second to back out of this. And yes, it is social learning and imitation. By demonstrating responsiveness to an infant's distress, the home visitor gives the caregiver an observable example to imitate, thereby increasing the caregiver's positive responses to their child's distress and thus promoting secure attachment. So now that we've defined what MOAs are and why they are important, what has HARC been doing to develop this shared language for the mechanisms of action component of the paradigm? As I described earlier, taxonomies, or what we like to call menus of options, are a way to organize concepts using commonly understood terms to make it easier for collaborators to communicate with one another. To develop the MOA taxonomy, the HARC research team began with an existing taxonomy developed by the Human Behavior Change Project, led by Susan Mickey. Mickey and her colleagues derived this original list of MOAs through an exhaustive review of over 80 different theories of behavior change. Through multiple rounds of activities with experts, they came up with a list of 26 unique MOAs and definitions that reflect the constructs common across the many behavioral theories. We didn't want to assume that this list was complete or that the definitions were understandable in the context of home visiting. So we took this list of 26 MOAs, and through multiple rounds of our own surveys, we gathered feedback from 73 intervention researchers and representatives of 17 evidence-based and emerging home visiting models. We asked them about the clarity of MOA labels and definitions, the distinctness of each MOA, the relevance of each MOA to home visiting models, and the comprehensiveness of the list of MOAs. We revised the labels and definitions of the MOAs based on feedback from each round of surveys. From these survey activities, we developed a resource that includes a list of 26 MOAs and their definitions. This list reflects the refinements that we made from the survey activities. This resource is now available on the HARC website. So next, we will hear from Heather.
Thanks, Lori. It's great to be here with all of you today to talk a little about context. First, let's start with the definition. Context may be defined as the social ecosystem in which home visiting participants and programs exist, and it may be described as the characteristics arising from systems, communities, organizations, families, and individuals. Context is key to understanding what works for different people in different situations. It influences home visiting access, implementation quality, intervention effectiveness, and outcomes. So let's take another look at the context box within the precision paradigm. As you can see by the arrows on the slide, context plays a role in the causal pathway from intervention to outcomes in three important ways. Next. Context can enhance or diminish the impact of the home visiting interventions on intended outcomes by influencing how specific intervention techniques affect mechanisms of action, or MoAs. For example, an intervention designed to promote a specific behavior through building knowledge using a smartphone app may not result in increased knowledge if the participant does not feel comfortable using smartphones or does not have access to reliable access to a smartphone. A relevant research question might be, how does participant technological literacy and access to technology enhance or diminish the impact of an educational app? Context can enhance or diminish the impact of the home visiting intervention on intended outcomes by influencing how well MOAs lead to selected behaviors. For example, a home visiting program that aims to prevent child injury might provide safety measures like stair gates and outlet covers. Providing resources to alter the home environment offers an opportunity for the caregiver to take precautions to improve home safety for the child. However, landlord restrictions might prevent the caregiver from properly installing safety measures. A relevant research question might be, how do housing policies enhance or diminish the impact of efforts to modify the home environment? Context influences home visiting usage. For example, a participant who feels that their home visitor shares their cultural values around parenting may feel more connected with the home visitor and more satisfied with services overall. A relevant research question might be, how do shared values between families and their home visitors influence acceptance of home visiting services? As Lori stated, the purpose of a taxonomy is to offer a shared language or a menu of options to make it easy to communicate with one another in designing and testing interventions and to accelerate what the field can learn across different interventions and across different studies of them. To develop the contextual factor taxonomy, the HARC research team began with a list of contextual factors identified by Brownson et al. In their 2022 article titled Revisiting Concepts of Evidence and Implementation Science. We expanded the list through a high-level literature scan, and we consulted with home visiting parent leaders to better understand how context influences their experiences in home visiting. Steps 4 and 5 that you see on the slide are upcoming. Our plan is to engage home visiting partners, including additional parent leaders, home visitors, model representatives, and researchers to understand contextual factors and their effects on home visiting experiences and outcomes, and to continue revising the contextual factor list based on learnings from these partner engagements. Currently, the taxonomy is organized into 5 levels based on the socio-ecological model. There's an individual level, the interpersonal relationship family level, organizational level, sociocultural and community level, and political and economic structures and systems. However, we acknowledge there may be other ways of conceptualizing context. Context may be thought of as a concept without distinguishable levels. For example, some people may not consider their individual context as separate from their community context. In addition, some factors span across levels, are interdependent, or may shift from one level to another based on different interpretations of the factor. And finally, some factors are broad, whereas others are more specific examples that fall within those broader categories. The taxonomy is definitely a work in progress, and future efforts to revise the taxonomy will include specifying a hierarchical structure. So let's talk about the levels in a bit more detail. We'll start with the political and economic structures and systems. So these contextual factors are the larger system of policies, politics, regulation, funding, and other factors in which the programs are situated. So on the screen, you see just a few examples of political and economic structures and systems. They include factors like colonialism, policy, legislation, and structural inequities. Sociocultural and community contextual factors are characteristics of the broader community in which families exist, including the built environment and social networks. A few examples of sociocultural and community contextual factors include norms, community resources, neighborhood characteristics, and traditions. Organizational contextual factors are factors embedded within the agencies and organizations that offer home visiting programs. A few examples of organizational contextual factors include organizational mission, organizational norms, staff composition, and training. Interpersonal relationship, family contextual factors are relationships and social networks, including friends, family, and work relationships. A few examples of these contextual factors include family structure, parenting practices, relationship status, and social networks. Finally, individual contextual factors include experiences, situations, and characteristics of a family or individual participating in an intervention. A few examples of individual contextual factors include primary language, attachment style, determination, and empowerment. So now that you've seen a few examples of contextual factors, we want to take a second to hear from you. So think for a second about one contextual factor, access to home visiting implementation quality, or home visiting outcomes that you would like to see explored in home visiting research or evaluation. And go ahead and type that in the chat. Remember that the list that you saw on the previous slides include only a few examples from our full taxonomy. So there are many more contextual factors on the list. There are also ones that potentially we have not included yet. So we want to hear from you. You can add anything to the chat that you can think of. And I'm just going to give it a second. And wait for something to come in on the chat. Socioeconomic status. Thank you, Laura. Yeah, certainly. John wrote in cultural norms about father involvement in the early years. Fantastic. A lot coming in now. Tribal sovereignty. Thank you, Ramona. Community safety. Absolutely, Shannon. Cultural norms about receiving external support. That would be very interesting. I see Jessica chatted in access to community health providers as it relates to referrals. Absolutely. Emily says infrastructure and transportation. Kristen said other resources available in the community. Yeah, absolutely. A lot of good opportunities for research there. So thank you for that. All right, we'll keep those ideas coming in the chat. I'm going to keep it moving, but we love to see that. So thank you so much for your participation. Great. So the list of contextual factors can be found on the HARC website at www.hvresearch.org. And we're really looking forward to using this list as a starting point for further discussions. So next, we are going to hear from Becky. Becky?
Thanks, Heather. So today I'll be focusing on the usage box of the precision paradigm. Usage focuses on both reach and engagement. While today's presentation focuses on engagement, I'll provide a very brief overview of reach here. Reach focuses on coverage of home visiting programs and whether families who might benefit from home visiting can enroll and participate if they choose to do so. Elements of reach include availability and accessibility of home visiting programs, people's awareness of home visiting programs, and program eligibility criteria. Outreach is a key component of reach that focuses on how programs and staff identify and connect with eligible or potentially eligible families. Strong outreach can ensure equitable distribution of home visiting resources. I'm not going to say much more about reach today, as our work to date has really focused on engagement. So we're excited to share the work that HARC has done to develop a shared language around engagement. We know that others, including many of you, have done tons of work on engagement, and we've used and built on that great work. So before talking about our work to conceptualize engagement, I just want to briefly discuss its place in the precision paradigm and home visiting research. So engagement plays a pivotal role in the precision paradigm. As you can see in the slide, looking at the red arrows going towards engagement is influenced by features of the home visiting intervention. That is, the content or methods of delivery of home visiting interventions are hypothesized to directly influence participants' engagement. Engagement is also influenced by the context in which home visiting services are delivered, including peoples, settings, systems, and structures that Heather just talked about. Focusing on the red arrow going out from engagement, we see that engagement may strengthen or weaken the link from intervention to the mechanisms of action. So engagement plays a key role in understanding who benefits from home visiting and why. But it's important to note that the validity and usefulness of research incorporating engagement really depends on how well engagement is conceptualized and measured. And conceptualizing and measuring engagement is no easy task. So before we share HARC's conceptualization, we wanted to hear how you think about engagement, which is a topic we know that is dear to many of you. So I'm going to put a link in the chat. We're going to do a quick word cloud. Yeah, so if you just click on that link, you should be able to go into the Mentimeter and do the word cloud. And I'm just going to share my screen for a minute so we can kind of see what is happening as you all fill in the word cloud. I just need a minute to get the right screen up. Here we go. So go ahead and you can type up to 3 words that come to mind when you think about family engagement and home visiting. And given we're kind of tight on time, we're not going to have a ton of time to do this, but just keep it flowing. Great words. So difficult to measure, facilitation. It's moving around in front of me, so it's hard to read it. It's essential, it's crucial. Relationships, motivation. This is great. I'm seeing some things that are gonna sound similar when I talk about our conceptualization. Facilitate, interest, trust. I'm really excited to be able to keep this too and read all of them more closely. Outreach, dose. So some great words here. Keep it coming in. I'll probably switch back to the presentation in a minute just because of time. We still have quite a bit to get through.
Do you want me to go ahead and?
Yep, we can go ahead and go back. So I'll stop sharing, but thank you guys for that. Let me just get back to my notes. So next slide, please, Lori. So thanks for sharing that. And I think, I saw some new things and some things that will look familiar as I talk about our conceptualization. But before we do that, I just want to say, what do we know about engagement from the home visiting literature? And as many of you know, the traditional research paradigm in home visiting has often relied on easily measured indicators of engagement, things like dosage, expressed, for example, by the number of completed home visits. Also things like duration of enrollment or retention in a program up to a certain point. And while low dosage may undermine home visiting effectiveness, because families have fewer opportunities to receive content and curriculum, they have fewer opportunities to get referrals, and they have fewer opportunities to learn from their home visitors, among other things. We know that this narrow representation of engagement tells us little about the underlying reasons for low dosage or about family subjective experiences in home visiting. Further, by the time poor engagement shows up via inconsistent attendance at home visits or an early dropout, it may be far too late to intervene and re-engage families. We've already lost them. So efforts to improve family engagement really require a more comprehensive conceptualization than dosage. So here are the methods we use to conceptualize family engagement to start to provide a shared language. To do so, I'm going to take you back to 2019 to 2021 to a project that was called McVie Program Developing Strategies to Facilitate Cross-Model Collaboration and Data Sharing. We call that the MoAs project for short. For the MoAs project, a team of HARC researchers collaborated with 10 evidence-based home visiting models and HRSA to build home visiting models capacity for collaborative research to answer priority questions by sharing existing data. And here we really focus on data from home visiting models management information systems, or MIS for short, which are home visit records essentially. So the project had lots of activities, which I don't have time to get into. But one of the main activities included working with home visiting models to identify high priority research questions. And not surprisingly, engagement was a topic in many of these high priority questions. So one strand of the MoAs project focused on conceptualizing engagement and exploring the potential of using home visiting models, MIS, to carry out collaborative research on this topic. So here's what we did, and you can see it in the slide. So first, we carried out a rapid review of reviews of the engagement literature to understand how engagement is defined and conceptualized. This was within home visiting, but also some adjacent fields like mental health services, social work, child welfare. The rapid review focused explicitly on review articles, theoretical articles, and conceptual articles, rather than individual empirical studies, because it was rapid. After a lengthy process, 41 articles were selected, summarized, and synthesized, and we came up with a working definition of engagement and some key concepts. Concurrent with the review, we conducted interviews with representatives of the home visiting models who participated in the MoAs project. This was to gather their perspectives on family engagement. We also met with them regularly during project meetings as we were conducting the review and synthesizing literature to validate emerging findings. So it was really sort of a joint process. And then finally, we reviewed their MIS data to assess its potential in measuring family engagement according to our conceptualization. So we examined the number of home visiting models that could measure each of the concepts identified through the review. So if any of you saw or remember our presentation from 2 years ago, you'll see that this definition has evolved as we've shared our work and got more feedback and learned more. So here's where it stands today. Engagement is a multidimensional state expressed through participants' thoughts and feelings, the internal states, as well as their behaviors, or external states, regarding their home visitors and the services provided. It's important to note that engagement is dynamic. That is, the internal and external states of engagement shift over time as relationships evolve and families receive services that do or do not meet their expectations. So let's elaborate on those internal and external states to bring this definition to life. So first, the internal states. The internal states of engagement reflect participants' thoughts and feelings regarding their home visitors and the services they receive. They are sometimes referred to as cognitive or affective engagement. Internal engagement includes 7 concepts. So these include participants' interest, motivation, commitment to home visiting, their readiness for change, their perceptions of home visiting acceptability, relevance, and goodness of fit with what they want and need, their perceptions of home visiting effectiveness for achieving meaningful goals, their satisfaction with home visitors and with services, their perceptions of their home visitors, such as whether they are trustworthy, honest, respectful, and responsive, and their perceptions of their relationship with their home visitors, including things like reciprocity and alignment of goals, roles, and styles. And during interviews and conversations with home visiting model representatives, they emphasize the importance of strong working relationships between home visitors and families as the foundation for family engagement. They also mentioned other internal engagement concepts. They described the importance of family satisfaction with and commitment to the program. Several models described aspects of intervention, acceptability, relevance, and goodness of fit, including participants' need for clarity of purpose and buy-in to participate effectively. They noted that families' readiness for change and beliefs that home visiting could help them were critical to the family's achievement of desired outcomes. Okay. And then the external states of engagement are demonstrated through the behaviors and actions participants display related to home visiting. This is sometimes referred to as behavioral engagement. Common concepts related to external engagement include families' enrollment, their attendance at visits, and their retention or their duration in home visiting programs. These are really similar to those dosage indicators we talked about a moment ago that we often see in home visiting research. Caregivers' participation in recommended activities during and between visits is also important. During visits, you might see participation that includes collaborating with home visitors, sharing opinions, asking questions, and participating in the curriculum. Between visits, which often is referred to as homework in the literature, participation includes follow-through on planned activities and application of skills learned during home visits. Home visiting model representatives also describe several concepts related to external engagement, including families completing visits according to the intended schedule, actively participating in activities and curriculum during visits, and then applying what they learned between visits. So how do these concepts align with what we currently measure in MIS? We had access to a few home visiting models, MIS, as part of the MoAs project, and we examined the extent to which they could measure any of the 7 internal engagement concepts, or the 5 external engagement concepts that we just described, using their MIS data. So what did we find? Well, not surprisingly, most or all of the MIS could measure the traditional dosage indicators. That is, they include things like dates of enrollment, dates of home visits, how many home visits, dates of discharge, which can really be used to examine enrollment, visit attendance, duration, et cetera. The wide availability of these data is really reflected in the extant literature on family engagement and home visiting, which to date has been dominated by studies using these concepts, which are pretty easy to observe and measure. So they serve a really good purpose. But the MIS was very limited to measure other aspects of engagement. Not only were internal engagement concepts really measured in MIS, those that were not consistently operationalized from model to model. Even the external engagement indicators of participation during and between visits was fairly spotty. Thus, our current capacity for really a nuanced study of family engagement based on our conceptualization that uses MIS data is a bit limited at this time. But let's end on a positive note. We've made strides in introducing this conceptualization a few years ago and have made, I think, some progress towards this shared language of family engagement. The conceptualization is being used by many members of the McVie Family Engagement and Health Equity Coordinated State Evaluation Peer Network to frame their evaluations, including my team in Massachusetts. So hopefully more to come on that as our findings start to emerge. Another one is that building on the rapid review conducted for MoAs, and as part of our work in Massachusetts on the CSE, my team at Tufts University has developed a compendium of survey measures that examine the different engagement concepts, I think with a heavier focus on the internal engagement. We've shortlisted about 25 measures that seem promising, and we do plan to finalize this compendium and make it available through HARC as well as through our website at Tufts. And then finally, at long last, we're working hard to revise and finalize a manuscript version of our conceptualization. We've been working on it on and off for a while, but have made some great strides lately. And so now I will pass it back to Lori, who will start walking us through an example of how the precision paradigm can be used.
Great. Thank you, Becky. So let's start by, for our example, let's start by filling in the top row of the paradigm. We'll start again from the right. Many home visiting programs have intended outcomes related to child development and achieving important developmental milestones. One behavior related to achieving child development outcomes is parent follow-through on referrals to services such as early intervention. There are many ways a home visitor can work with a parent to do this, but one technique a home visitor may use is to provide parents with information on the benefits of EI services. A mechanism of action from our taxonomy that provides a possible theoretical link between this technique and the selected behavior is beliefs about consequences. Individuals' beliefs about what will be achieved or lost by engaging in a behavior, including whether a behavior will lead to a specific outcome. So a caregiver's beliefs about the benefits or risks of EI services, or whether EI services will actually lead to improvements in their child's development, are likely to affect whether or not they decide to follow through on a referral to EI services. Now we have outlined our top row of the paradigm. We have a specific intervention technique with its link to a selected behavior that is tied to an intended program outcome. Research questions derived from the paradigm are often framed around the arrows between two or more of the components. So here, one could develop a study to test the association between this technique and this mechanism of action. One might ask, does providing information on EI services influence a parent's belief about the consequences, whether good or bad, of EI services? You could imagine if this study did not find an association, perhaps the information being provided was missing the mark in some way and requires modification, or perhaps providing information alone is not adequate to move a person's beliefs about possible benefits of the service. One could extend this by asking whether this influences actual follow-through on EI referrals. So are beliefs about consequences associated with actual referral follow-through, and does providing information on EI influence a parent's follow-through by changing their beliefs about consequences? A study could stop here, as it provides information on the association of this intervention technique on this selected behavior for families overall. But these questions don't consider contextual factors that might influence this path in very important ways. And so for this, we'll hear again from Heather.
Thanks, Lori. So what you saw in Lori's walkthrough just then was the top row of the precision paradigm outlined, and that really looks at what is intended. It offers a theory of change for how a specific intervention will theoretically achieve outcomes. To build on that, I will talk about context and the important ways that it may influence the theoretical pathway from intervention to outcome. So for the purposes of this full example, we'll focus on two contextual factors. The first is mission and priorities, and the second will be institutional stigma and racism. Becky's going to talk about that second piece. So for now, in thinking about organizational mission and priorities, just want to point out that based on our conversation earlier, these factors fall into the organizational level. So just want to note that. So a research study might consider how contextual factors enhance or diminish the impact of parents' beliefs about the benefits and consequences of EI services on following through with a referral. Here we can see the importance of context in influencing home visiting outcomes. That is, it serves as a moderator of the association between the MoA and the selected behavior. In other words, there may be certain contextual factors that may strengthen or weaken the association between the MoA, which in this case is the beliefs about consequences on following through on an EI referral, and the selected behavior, which again in this example is following through on that referral. So let's get a bit more specific using the example contextual factor of organizational mission and priorities. A research study could ask, are parents more likely to follow through on EI referrals if the home visiting organization prioritizes service to children with special health care needs versus organizations with broader missions? So let's say a home visiting program is housed in an agency that's mission is to support children with developmental delay. And in keeping with that mission, the organization houses EI program. Organizations with co-located home visiting and EI programs may be more effective at bridging the gap from the belief that EI would be helpful to completing or receiving EI services by making it easier for a family to connect to services or providing a warm handoff between home visitors and the EI practitioner, for example. This illustration demonstrates the importance of considering context when studying interventions' effect on a selected behavior. And a study could stop here. However, these questions don't consider usage, which might also influence these paths in important ways. For this, we'll hear again from Becky. Becky?
Making sure I unmuted. I did. Thank you. So first we see that contextual factors can influence usage. For contextual factors, we're focused specifically on institutional stigma and racism, higher level factors that focus on economic and political structures. In particular, we can think about examining how institutional stigma and racism affects aspects of internal engagement, notably families' perceptions of their relationship with their home visitor and the degree of trust they have in their home visitor. We can ask the question, how does institutional stigma and racism influence parents' perceptions of their relationship or trust in their home visitor? Families that have been negatively affected by systems of oppression, such as institutional stigma or structural racism, that may have limited their opportunities or created barriers to their well-being, may find it difficult to develop trusting relationships with people and helping professions, such as home visitors, especially in the early stages of the relationship. Understanding these contextual factors can help us understand variability or differences in family engagement. A research study could also ask, how does an individual's trust in their home visitor enhance or diminish the impact of providing information on EI services on parents' beliefs about the benefits and consequences of EI? Here we see the importance of engagement in influencing home visiting outcomes. That is, it serves as a moderator of the association between the intervention and the mechanism of action. Let's unpack what that means. The idea is that a participant's perception of their home visitor and their relationship with their home visitor may strengthen or weaken the association between the intervention and the mechanism of action. So, in instances where families really vibe with their home visitor and trust their home visitor to have their best interests in mind and understand what their family needs to strengthen and support them, the provision of information on EI is likely to have a strong influence on families' positive beliefs about the benefits of EI. On the other hand, if the family does not trust their home visitor and has not developed a mutual and reciprocal relationship with them, the provision of information on EI may have little influence on their beliefs. It could even have an unfavorable influence where they're against the belief that EI could help them. So both of these examples demonstrate the power of engagement, focusing on internal engagement. So in closing, we know this was long. We hope this example has made the precision paradigm come alive for you and how it is a very useful tool to develop and think through more nuanced research questions in home visiting. And we hope that today's overview of the work HARC is doing to build a shared language and provide examples of how the precision paradigm can be used is food for thought as you think about your burning research questions in home visiting. Building the precision paradigm includes developing a shared language to support relevant research that produces meaningful results to guide program improvement and policy. And this is very much a work in progress, and it takes time. It includes lots of input, including from all of you. So we really do encourage ongoing feedback and participation in HARC activities from all who have an invested interest in home visiting research. So ways that you can participate right now include become a member of HARC, accept invitations to participate in paradigm building activities, submit your feedback on resources on the HARC website. Let us know how you're using the precision paradigm in your work, and reach out to us with any questions. And you can see we have some contact details there. And we just want to thank you all for your time and for listening today. Thank you so much.
Sorry, I was muted. I was just saying thank you guys. That was a terrific presentation. I'm looking in the chat for questions. I'm also looking at my clock and it says 3:29. We're going to get booted out of the room in a minute. I'll ask one question real quick. And that is, I have to admit, I have a love-hate relationship with precision paradigm. Of course, it's right that not everyone reacts the same way to interventions, but there seem to be an infinite number of potential modifiers. What do you see as the end game there? In other words, when we asked people to put in the chat box, what are some factors on which they would want to see precision work done? There was a diversity of responses. What do you see as the end game? Are we going to have many versions of each home visiting model for people with different characteristics? How will that work? It's a big question, I know.
That is a big question now. I don't know, Becky, Heather, feel free to jump in. I'm trying to think quickly on the fly.
I would just say, yeah, I don't see a million different variations of home visiting models, but models, are these big things, right? But in reality, every day, home visitors are making modifications to what they're doing in the home based on contextual factors that they're seeing in real time. They're seeing those factors play out. And the same is true with research, right? Like we want to get more precise about the ways in which we're talking about context and, measuring it potentially. And so we want to encourage that. And that's really kind of the end game. So again, this is evolving, it's ever changing. So we're learning as much from the field as, certainly as we're putting out there. So more to come.
Great.